Research shows that every 40 seconds, someone dies by suicide, and they never tell anyone that they're struggling. We live in a world full of noise, yet so many suffer in silence. Today's conversation is one that truly needs to be heard. I'm Krishna Verma, and in this episode for Suicide Prevention Month, I'm joined by Dr. Srinivas Kambhampati, a leading voice in psychiatry, to talk about mental health, depression, suicide, and why sometimes the strongest people are the ones who are fighting invisible wars. This session is not only for those who are struggling, but also for someone who understand, support, and change the narrative. Hi, Dr. Srinivas. Good morning.
Hi Krishna, thanks for having me.
Yeah. So why don't you please introduce yourself to our audience?
So I'm Dr. Srinivas Kambhampati. I'm the consultant psychiatrist at Swastha Clinics and Yuti Clinics in Hyderabad. My main area of focus is psychiatry as well as sexual health, along with marital counseling and sex therapy as well.
Okay, that sounds good. So why did you choose psychiatry?
So there are multiple reasons why I chose psychiatry. For one thing, psychiatry is one of those areas where we cannot know what is exactly happening. We all have our own set of battles that we fight every day. We all have those scars as well. It is not as the same scars where you see in orthopedics or any other department where everything is visible. In psychiatry, everything is invisible. So to find out that is what excited me during my study days, so that's why I chose psychiatry.
Sounds fascinating, yeah.
Yes.
So I want to talk about the role of your father.
Yes.
I have been researching about Dr. Kambhampati Swayam Prakash, and it's quite fascinating that the amount of people that he had helped over the years. So
Yes.
what kind of an impact does he have on you?
Oh, he had a massive impact, there's no doubt about it. My father was one of the oldest sexologists in United Andhra Pradesh. He saw over 1 lakh patients back in the day, and
Wow.
he touched many lives. So that was always a state of motivation for me. Even when he was there and after he passed, it became even bigger impact for me to live up to his name. So I want to do something similar in my own way to touch as many lives as I can and help them in the best way I can.
Sounds lovely. So if you could mention the 3 things that you have learned from him, what would they be?
So 3 would be very small of a number, but I would still try. To begin with, one thing is listening without judgment, because both in psychiatry as well as in sexual health, we do see a lot of clients who come with a varied spectrum of disorders, right? So you cannot be judgmental towards them.
Right.
You have to be as open as you can, and you have to understand their problems, feel empathetic towards them, and try to help them in the best way you can.
That's right.
The second thing is understanding their problems without any preconceived notions as well. Because what might be a huge problem for one of them might not be a problem for another person.
Yeah.
There is no comparison in pain, right? So
Right.
You need to understand their pain. You might not think it is such a big deal, but you still have to help them in the same way, because the suffering is still the same.
Yeah.
And the third thing, when you're trying to help a person, it is never you just tell them what to do. It can never be that. You are part of their journey, and you have to take share of their suffering and their pain, and you have to move together. That was something my father always told me, you're in partnership with the client. He's never on his own.
Right.
Only once you become part of their journey is when they can start healing, and you would feel good about yourself as well. That is the main thing.
So once you have the emotional connection,
Exactly.
you'll be able to guide him better.
Definitely.
Yeah.
It doesn't work otherwise.
Yeah, that sounds good. So now that you have been in this field for over 5 years,
Yes.
and you heard a lot of problems, you listened, you understood, and you treated a lot of patients. What is psychiatry to you today?
Psychiatry is a very important part of everyone's life. It is one of those silent battles we all face. We all have our own set of scars that we have been shaped. I had my own struggles with my mental health back in the day, and I grew from that.
Okay.
And we all have phases in our life where we have to learn from whatever that we are going through.
Okay.
And psychiatry is very important in that thing, like it opens up the person to who they actually are. And once you have that, like you can grow. And it's not just like one person is different from another person. We all have our own silent battles that we face each and every day.
Yeah.
Once we start identifying those battles, and once we learn from those battles, is when like we start growing as well.
Okay. Right. So silent battles, that word, it has
Yes.
a lot of weight. It sounds powerful and also apt for the situation.
Exactly.
So why do you think people suffering with the strongest mental health issues stay silent?
There are multitude of reasons for that. We cannot put a finger on one thing and say that this is the reason why like they're being silent. But when you see like the overall picture, why majority of them are silent is because they hate being judged. They hate people think that like they're anyway weak. And they don't want that sympathy from others as well.
Okay.
When you say like you are having some problem, rather than trying to be there for you, majority of people like show the sympathy, or they show the pity,
Yeah.
which becomes very hard for some people to take. They don't want the pity from you, they want the shoulder to cry on for some instances, or like
Yeah.
the hand on the shoulder in other instances. And just like listen to your like problems, whatever you're facing. Like they just want that battleground with like another person, where like they can talk it out, and like they can grow from the conversation as well.
Yeah.
For that reason, majority of them like they don't know how the other person is going to react for a problem which might be a huge thing for some person. If the other person dismisses that, like it becomes even worse.
Right.
So for that reason, they stay silent.
Yeah. Okay. So especially I think people with a strong ego or some pride about
Exactly.
themselves, they'll be more reluctant to share because they might think others would judge them as weak or something
For sure,
like that.
yeah. In the society at large, like we've been brought up, especially as men, that like you have to be strong. And once like everyone says you have to be strong, like you cannot
Yeah.
open up about your vulnerabilities.
Yeah.
But the fact of the matter is, every one of us have our own set of like vulnerabilities that we need to share with people as well.
Okay.
Yeah.
Right. So let's begin with today's topic, suicide prevention.
Yes.
I recently got to know that for every 8 minutes, an individual commits suicide in the world.
Unfortunately, yes. Yeah.
Yeah. So let's begin with the hardest question. What really triggers a man or a woman to suicide? What renders them so helpless that they decide it is better to end their life?
The triggers are very vast. Every age group, every gender, every person, it is different. There are no two people who commit suicide because of the same trigger. Again, like I talk about like the smallest of things impacting the biggest ways, right?
Okay.
So when you take a young adolescent, or someone in their late teens, the commonest thing is like because of the pressure from school,
Right.
the lack of scores. We are in a society where like one result can impact our whole life,
Yeah.
which is a huge burden for anyone to take, and especially someone in their early or late teens. Like it is very difficult for them to take that.
Yeah.
As we grow slightly older, someone in the young early 20s or something, it is usually like relationship issues, it could be financial issues, it could be like some other stressor which is bothering them, or it even could be like because of the influence of any drugs or anything. These
Okay.
are the commonest reasons why we see like that age group like commit suicide. As we get older, like it is usually like even more stressors, like either related to their personal life, in their relationships, or it could be stressors pertaining to like their professional life, the pressure from the workspace. It could be financial, like burdens which is dragging a person down. So again, like it could be multitude of reasons. We are seeing a lot of young men and women commit suicide because of the stress from the workspace. They're not able to deal with the toxicity. We are seeing this problem is not specific to, there are more number of say for example one set of persons who are committing suicide. It is there everywhere. There are multitude of colleges, there are multitude of professionals, people who are in the best of these situations also are vulnerable to this. So it is very difficult to pinpoint this is a trigger for them or this is a trigger for them. It becomes very hard to pinpoint like that. But one of the commonest when you filter down everything, it is the stress. It is our inability to deal with stress, or when the stress keeps on piling up, that is the huge trigger for majority of them.
And when the stress is developing, and especially if if I am not someone who's willing to talk, again that will be a more too much stress on me.
Exactly.
As well.
And in cases like this, it doesn't add up, it multiplies the stress. As you're just not talking to anyone, there is no outlet for you, and there is more and more that you're taking, it becomes double and 4 times, 16 times like that, and keeps on increasing, and that becomes the huge problem.
Okay. So there is this new case that we are seeing right now about online games and online loans which are driving more suicides. So what do you have to say about that?
Gambling has always been a problem in a country like India. There is no denying that fact. But the difference between back in the day and right now is the ease at which you can gamble.
Yeah, exactly.
Back in the day, you can only go to a certain place where you need to gamble. But right now, there is an ease of, we have our whole world in our hands, in our phones. So and even taking a loan becomes very easy. All you need is a single document with which you can, it doesn't matter if you have the repaying capacity or not, you can still draw a certain amount of money. When it becomes so easy, people tend to forget what are the outcomes of it. Once they go deep into it, there is no way out. Once it's like a quicksand. Once you go inside, it keeps dragging you down. And once it keeps dragging you down, you tend to bet bigger to win bigger. And that becomes the problem. And this is something which we are seeing very often these days, especially during the months of massive games and everything. There are a lot of people who are spending so much money. They are losing big. We are getting clients who have lost 18-year-olds who have lost 30 lakh rupees. And they come from backgrounds which are not so well off even. And that becomes the problem. So you don't have a way out. And then things become very clear, they become very real even. And that is when you go deeper into your mental health issues. There are a lot of depression cases, there's anxiety, how are you able to repay them, what can you do to repay them, and that becomes the problem. And
are there any warning signs of suicide in someone who's really struggling? What are some red flags?
There are multiple. Again, first thing is social withdrawal. A person who could be very open, usually he or she is in the middle of all the conversations and everything, they become very withdrawn. They don't want to interact with people. They're just in their own mind sometimes. They're just thinking about a lot of things. They're not interacting as they used to previously. That is first thing that we notice. The other thing is change in mood. It could be someone becoming more angry. They could be very irritable. They're struggling with things which they're not able to speak out about. So that becomes very clear. And coming to other warning signs, we can see the sleep patterns change, their food habits change. Another thing which we see in the middle age groups is lack of inhibition. They don't care about anything. So they suddenly start, for example, drinking more. or they're getting into newer habits,
Okay.
because they just don't care anymore. This is something which we see very commonly. We get a case with alcohol addiction or something like that. When we dig deeper, he's struggling with something much deeper, and to mask that pain, they are going into something even worse,
Yeah.
because they just don't care.
Okay.
So that is another thing which we need to see. And they just stay silent. How much ever you ask them, like, they don't want to talk about what they're going through.
Yeah.
So these are all, like, subtle signs that you see in people. If there's any change from their normal personality, it should always, not as a red flag, but it should always be evaluated. Why is it that they're not in the same way that they have been? Is there something that they're going through? Is something which we need to find out,
Yeah.
either with the help of a professional, or, like, it could be a friend, it could be a partner, it could be someone in your family. You see some changes in their personality, just ask them,
Yeah.
hey, are you okay? Like, is there something that you want to talk about? This just one line
Yeah.
could alter the next subsequent events as well.
Okay. So that brings the next question. If I know that someone is struggling, if I identify that someone is struggling, how do I approach them? What would be the best way to talk to them? What are the things that I need to say, and what are the things that I need to avoid to
Yes.
making the situation even worse?
See, every situation is different, but at the same time, like, you need to start at some point, right?
Yeah.
So just go and talk to them honestly.
Okay.
You are not trying to do them a favor by talking to them or anything of that sort, right? Just go and talk to them. Ask them, like, are they okay? Is there something they want to talk about? Give them a safe space. Don't discuss about whatever they tell you to other people. Just listen to them. Understand, like, what is it that they're going through. It might not be something which you might be aware.
Yeah.
It might not be something you understand even, but just hear them out.
Yeah.
Sometimes, like, what that other person might need is someone to hear them.
Yeah.
And another thing, a lot of the attenders who come with my clients, like, they ask me is, sir, we never mention the word suicide. Like, we don't want to use the word suicide. We might give them ideas. It is never the case. You can always ask about, hey, are you contemplating suicide or something like that? What happens is, like, it breaks the ice for them, and they might actually open up.
Okay.
Once you use the word, you will never put the idea in them.
Yeah.
You can just, by asking them, like, it would help them come out of their shell even.
Okay. And I think that is one of the reasons as well. Like, they're reluctant to talk to other people just because that if he or she shares the problem with them, they're afraid that they might tell to a lot of people and then
Exactly.
bringing the wrong perspective.
So when you are worried about something like that, you can just have a conversation. If you feel like, they are not opening up, you can help them go to a specialist. You can help them, take them to a psychiatrist or someone in the mental health space, so that they can talk to them. It is a neutral zone, like, where they can open up.
Yeah.
So that way you can help them. And there are a lot of helplines as well which are open these days for someone who is contemplating suicide.
Let's talk about social media.
Yes.
Have you seen any cases where social media impacted on the person's depression or even increased their suicidal thoughts?
This is a very good question, Krishna. First thing, like, I want to start this section off by saying there are multiple advantages with social
Yeah, of
media.
course.
It actually helps a lot of people interact with more people at the comfort of their own space and
Yeah.
everything, and it globalizes the nation as well. But at the same time, the negatives of social media sometimes, in some cases, can outweigh the benefits
Yeah.
as well, especially for someone, like, who is already depressed. They see other people, like, enjoying or something like that. There is a lot of comparison, and that brings them even down.
Yeah.
There's a lot of cases of anxiety which come up, like, because of social media even.
Yeah.
And unfortunately, like, how the algorithm works, even you see one reel which is related to either suicide or depression or something like that, it keeps on showing you something like that.
Yeah.
And that can actually bring a person down further. So
Yeah.
that becomes a problem, because there's no way out for them.
Yeah.
They're already, say for example, they're already socially withdrawn, and they're just on their own looking at content online, and all the content that they're seeing is
Yeah.
more and more negativity.
Yeah.
That can impact their mental health a lot
Yeah.
more.
Especially a lot of people are addicted to binge watching the reels. So
Yes.
if the content is all about suicide and depression, that would again increase their thoughts, add more weight to that particular feeling.
For
that they
sure.
have.
So you need some escape from this.
Yeah.
And when your outside life is already overwhelming,
Mm-hmm.
the social life also, like, cannot be overwhelming.
Okay.
And once they start consuming content like that, it does become very overwhelming,
Yeah.
and that becomes a bigger problem.
Yeah.
And that needs to be addressed much more quickly even.
Yeah. And also, I believe quick judgments, like whenever someone sees a person doing good on Instagram, like going to vacations, leading a happy life, something like that, they immediately start to believe that they are losing, that they are on the negative side of it, that something is wrong with them.
Yes.
Yeah.
So this is something which we see commonly, like there's a lot of comparison. We
Yeah.
live in a day and age where, like, there's a lot of comparison. First thing we need to understand is, like, just because someone is posting something, it doesn't mean, like, the other
Exactly,
person
yeah.
is not going through some hard days as
Yeah.
well. And we all tend to put our best foot forward every time.
Yeah.
And we want to show the good things in our life.
Yeah.
But lately what is happening is, like, the content which is being shared is so far away from the reality.
Yeah.
You're putting a facade in front of the camera, and you're just putting something which is not true forward. That becomes a problem to someone, like, who is already going through some struggles.
Yeah.
It becomes even worse for them.
Right. So I'm sure there are a lot of myths around suicide. Why are they dangerous? What would you like to say about them?
The first myth is something which we already discussed, that is, a lot of people think that if you talk to someone who's already struggling about suicide,
Yeah.
they might actually, like, we might actually put a suicidal thought in them,
Yeah.
which is not true. Like, you'll actually be helping them just by breaking the ice. Like, they might actually open up with you even.
Okay.
And that is very important. The other myth, like, there's something called as laughing depression.
Okay.
Where, like, a person might be doing very good at their job. They might be doing they might put up a facade again to show that, like, they have a wonderful personal life and everything like that.
Yeah.
But they might be going through something much more deeper.
Okay.
And the myth is, like, when you see someone very happy, they might not commit suicide.
Yeah. Just because they're smiling on the
Yeah,
outside doesn't mean
like, they are
problems. Yeah.
having a huge struggle underneath. So having an honest conversation with any person would actually be very helpful. And once you see that, like, they are going through some struggle, like, have a conversation with them, just be normal with them.
Yeah.
That should be very helpful. So the other thing, like, there are a lot of people, like, who joke about suicide. There are a lot of people who just talk about it randomly in the middle of a conversation. They bring up something like suicide or something like that.
Yeah.
And many people think that, like, if he's talking about it, I'm pretty sure he's not thinking about it.
Yeah.
Or, like, they just dismiss the
Exactly.
they're very dismissive towards the word of suicide. When a person actually brings it up, it means they might have either thought about it, or like, they might be going through something, like, which there's more than what meets the eye, basically.
Visualizing.
So, like, we need to be very mindful about them, and, like, we need to talk to them even.
So we need to observe all the other signs as well, just to make sure that if they're struggling.
If there's anything else, like, just motivate them, or, like, just talk to them and ask them to go meet a mental health professional. That would be the better way to go about it.
Okay. So if I find someone who is struggling with suicidal thoughts, should I inform their parents? I mean, what kind of a role that the parents could play? I mean, especially we know about how Indian parents are. Some parents might again be dismissive. Some parents might even abuse their child. Like it's your fault. They even put more pressure that it's your fault. Why are you like? They'll ask questions like, why are you like this? I told you not to do this. Something like that.
See, in this case, it becomes very situational again. Like, see, for example, you as a friend is noticing one of your friends
Yeah.
go through some hard time. You need to understand, like, what, how would their parents react, like, because you might have known, like, how he's talking about his immediate family members and
Yeah.
everyone. So taking that into consideration, you need to take the next step.
Exactly.
If not the parents, they could have a sibling, or they could have someone else in the family who they might be close to.
Yeah.
So, like, either informing them, or just being a good friend and taking them to a mental health professional, that would also be helpful even.
Yeah.
If you feel like, there would be someone in their immediate family who would put more pressure on them, it is always better to avoid it.
Yeah.
Rather than encourage it. That would be the right way to go about it.
Okay. So what role does friends play in this?
Friends play a major role.
Yeah.
Friends are the family, like, a person chooses,
Yeah.
rather than the
Exactly.
family that they have been given.
Yeah.
Right? So friends do play an important role. Usually with a lot of people, they spend a lot more time with their friends than with their family.
Yeah.
And if as a friend you feel like, he's going through something, they have had a major incident in their life, either with their work, with their personal life, or anything of that sort, be there for them.
Yeah.
Just be someone who they can talk to freely. Never discuss about something your friend might say,
Yeah.
which might even be funny sometimes,
Okay.
because you might think it is a funny thing, or it could be a small thing.
Yeah.
But the fact of the matter is that small thing can impact in a bigger way.
Yeah.
And people always have this misconception that for a person to contemplate suicide, something big has to happen.
Yeah.
Which is never the case. Like, these smaller things keep piling on.
Okay.
So, like, when one of the friends is being very dismissive towards a small thing, or when they make fun of a small thing that is
Yeah.
happening, that can have a huge impact even.
Yeah.
So never ignore those small things as well.
If they start to believe that
Exactly.
my friends don't even care about me, something like
Exactly. And they cannot even talk about it, they cannot even
Yeah.
discuss about it. So just be there. Don't judge a person based
Yeah.
on the small things that they are going through.
that. Yeah.
And try to maintain that confidentiality.
Okay.
Because you never know, like, we all have the good days and the bad days.
Yeah.
When you need a friend, like, you would expect them to maintain that confidentiality, right? So you have to maintain that confidentiality and be there for them. That's the main thing.
Sounds good. So, if you were to suggest some coping techniques for someone who is suffering with suicidal thoughts and depression, what would they be?
So the first thing which we tell majority of our clients is journaling.
Okay.
It is a tool which has massive impact, right?
Yeah.
So just by writing your problems down solves, like, most of the problem even. So just by writing it down, you can visualize how do you get out of this.
Yeah.
So that way journaling becomes the best technique. The other thing is, like, simple relaxation techniques, breathing techniques,
Mm-hmm.
like box breathing or grounding technique, or JPM,
Okay.
which are relaxation techniques. They help a person, like, relax even.
Okay.
The other thing is just discussing, just having a conversation with another person. That is a huge help as well.
Okay.
Other than these things, like, taking care of your sleep also becomes an important role.
Yeah.
There's something called as sleep hygiene. We all have heard about our personal hygiene, we've heard about other hygiene
Yeah.
that we follow, but not a lot of people know about sleep hygiene.
Yeah.
So what are the do's and don'ts when which would help you have a better sleep? That becomes a very important thing. Taking care of your lifestyle, trying to be a little bit active,
Yeah.
that helps a lot of people as well. By working out, by walking even, it releases endorphins. It reduces the stress hormone, which is cortisol. That plays a huge role as well.
Okay.
So just being active, it need not be like, you need to go to the gym or get a six pack or anything.
Just starting a habit and sticking to it consistently.
Sticking to it. The consistency is key.
Yeah.
Be it with journaling, be it with sleep hygiene, be it with your physical exercises and everything.
Yeah.
You have to do it consistently.
Yeah.
You cannot expect changes from that just by doing it once or twice.
Yeah.
Just by doing it regularly, that would be very helpful.
Okay.
And walking is the best thing, which we suggest a lot of clients. It need not be for hours on end. It could be for 15 minutes. Just walk for 15 minutes every day.
Where you could just gather your thoughts in the
Exactly,
nature outside.
and that would be very helpful.
Yeah.
Preferably on ground rather than on treadmills. Like,
Yeah.
it will be very helpful.
Okay. Right. So like other medical problems or other mental health problems, can depression and suicide, can it also be treated with medicines? So when do a person include this in their healing process, include the medicines?
See, the first step of any mental health struggle is going to a specialist
Yeah.
rather than doing it by yourself.
Yeah.
There are some amazing medications that we use, be it antidepressants or mood stabilizers,
Okay.
which could have a huge impact in a person's life.
Okay.
So, based on the situation, based on how their other coping skills are, there could be a need for medications.
Okay.
And using medications doesn't make you weak.
Yeah.
Using medication is sometimes the additional boost that you need in life, and that could take you a long way even.
Yeah. In fact, it helps in the healing process a little.
For sure,
Yeah.
and it quickens the process.
Yeah. Exactly.
So, like, for a person who is using the other coping skills,
Yeah.
it may take them couple of months to get out of a cycle.
Yeah.
With the help of the medication, we can do that in a couple of weeks even.
Okay.
So in that way, like, we quicken the process, we make the process much more streamlined with the help of medication.
Okay.
We help the client gather the thoughts, like,
Yeah.
we can help them relax, and medicines tend to, like, lift off majority of the weight of the person's back even. So at this day and age, we have medications which are much more safer, which
Okay.
a lot of people do have a lot of negative opinion towards psychiatric medication, that they could be addictive or anything.
Especially that brings me a doubt. So I think many people would be under the misconception that they need to use this medication for longer periods of time, like probably their whole life to get to
Yes.
stay in that zone.
Which is never the case. I'm pretty sure there's no doctor who would want to put a person
Yeah,
on a
exactly.
medication when there's no need for the medication. So the medication is always, like, it is always tapered down.
Yeah, okay.
As the problem is reducing, we tend to taper it down, and, like, there are a lot of instances where, like, the medication is removed naturally even.
Okay.
But the most important thing is stay through the course.
Okay.
What happens in our day-to-day practice is a client might come when they're struggling. Once they start feeling better, they're not coming back.
Okay.
That becomes a problem because they haven't stayed the course.
Yeah.
And that makes them vulnerable to the same problem further down the line.
Okay.
By staying the course, what happens is the chance of having another problem, other similar problem, might reduce significantly.
Okay. And also not just medications, I think people are, once they have a good conversation with psychiatrist and they just leave it off there, they won't be coming back again, which is a bit confusing, or which is a bit maybe wrong, because these are very serious problems. Depression and suicide are very serious problems, and I don't think people would actually get solution from just one conversation with a psychiatrist.
For sure. Any of these sessions that we might have or anything of that sort, it takes multiple sessions. Usually, even for a person who wants to open up, they might not open up
Yeah.
everything in the first setting.
Exactly.
Our diagnosis might be, like, it's always evolving, and even the problem, like, we learn more and more information from each and every
Yeah.
session. So with that, we can help the other client, like, in much better way, and we could help them come out of the slump that they are in, like, in much quicker time as well.
Okay. So Dr. Srinivas, from your experience, why do you think men just stay silent even when it's very obvious that they're struggling with something?
That is the society that we are living in. That is how majority of men have been brought up.
Okay.
What a boy is taught from the time that a child
Yeah.
is, you're a boy, you're a man, you
Yeah.
cannot open up, you
Yeah.
have to be the provider, you
Yeah.
have to learn to take it,
Yeah.
and you cannot discuss about your vulnerabilities.
Yeah.
That is what, like, we've been taught from the childhood. That becomes a problem because as you're growing up, that thought becomes stronger. So what happens, you're never going to open up, you're never going to be vulnerable, not even with your partner, not even with your closest of friends. You always want to put up a facade that you're much more better than what is actually happening.
Yeah.
And that makes the silence even longer, even harder, and impossible in some cases to break. What usually happens is men committing suicide is usually a lot more fatal than women committing suicide,
Okay.
because they don't want to discuss about this, and they'd rather take the most drastic of steps even.
Yeah.
So that
And I
is the
think
problem.
movies also has a lot of impact on this, especially showing the main character as someone strong and depicting him in such a way that men are supposed to be strong, men are supposed to be the provider and all. So I think movies also might have a lot of impression on that.
In my personal view, like, the movies have a smaller impact
Okay.
compared to, like, what is being told from the
Okay.
childhood. uh, for a person who has been told, like, to be in tune with their emotions, no matter whatever
Yeah.
a movie or a TV show depicts, like, I don't think they might be as impacted by
Okay.
another person.
Okay.
Whereas, like, when you're constantly being told that, like, no, you cannot show your emotions, no, you cannot discuss about your emotions, no, you will be looked at as someone weak or not a man,
Yeah.
that becomes a problem. That
Yeah.
is when, like, the movies and the other things that they see and hear amplifies their thought,
Yeah.
and it doesn't go vice versa actually.
Okay. So I think when it comes to men, most of them, if they're going through some hardship, they just want to deal it with themselves. Like they want to
Yeah.
take it in their hands and they'll just want to deal it themselves. They don't even want their friends or family to know that they are facing this problem, right?
Yes. Usually that is the case that we see
Okay.
a lot more often than not.
Okay.
They don't want to be known as the person who needs help.
Okay.
They don't want to be known as the person who is very emotional, because it is frowned upon or it is made fun of.
Okay.
So for that reason, people, especially men, tend to stay silent,
Okay.
and they struggle alone.
Yeah.
And no matter how many people are around them, always they tend to be alone.
Okay. And I think I read this quote that really adds a lot of weight to this. Men are taught how to fight battles, but they're not taught how to feel.
Exactly. Yeah.
So I think in more simpler terms, we learn a lot of things. We learn about maths, science, engineering, medical, and all. But we were never taught about, we were never taught how to talk, how to open up.
Exactly. Yeah.
Right from the stage where we're growing up, right?
For
So I
sure.
think maybe that is where people really don't know how to talk or don't know how to open up about their feelings.
Yeah. That is the overwhelming problem that we are seeing lately. And as, like, a person starts talking, a person starts, it could start at something very minute, very irrelevant even, and about whatever they're talking about. Just by talking, you can help them, and they can change even. So
Okay.
that needs to start. A step needs to be taken at some point or the other, and talking is very important. And it has to be taught from a much more early stage.
Yeah.
And it has to be normalized.
Yeah.
Talking, or, like, even showing your emotion, crying in front of people,
Yeah.
it should never be seen as a weakness. In
Yeah.
fact, like, it takes a lot of strength
Yeah.
for a person to either talk to another stranger, or talk to one of their friends, or talk to their family, or, like, even to go to a psychiatrist, to go to a mental health professional. It takes a huge amount of courage.
Yeah.
And it is never a sign of weakness, it is always a sign of strength, that a person has actually wants to work on their mental health and wants to change.
Yeah.
So
Okay. So let's step into the digital world now. We have AI chatbots like ChatGPT models, Gemini models, which are designed for providing mental health care. In your perspective, do you think they are effective? Do you think they are helpful in any way, or could they be dangerous going forward?
We cannot talk about it at this point of time because we don't know how these chatbots are going to evolve down the line. But at the same time, where they are right now, they are not super helpful.
Yeah.
Yes, artificial intelligence is here to stay.
Yeah.
Yes, artificial intelligence has a lot of benefits in our day-to-day life.
Yeah.
It can be very helpful for us in a lot of different things. But I still feel like there is a huge black hole when it comes to these artificial intelligent bots to understand the human emotions. And that is where the psychiatrist, a person, is going to make a huge impact.
Okay.
Would it be dangerous at this point of time? A lot of times when you talk about these feelings to a chatbot, it might even minimize the situation, and that is a problem. Or for someone who's not having anything, it could say that they're going through something massive,
Yeah.
and that could bring up a whole other set of problems even. So yes, as good as using all these bots are important, there has to be a certain amount of understanding that this is not the final help. You still need a professional to look into, and we have to be in the mindset that there is a chance that these bots are making a mistake even.
Yeah.
So looking at it with an open mind would be actually helpful, rather than just taking each and every word that it says as something very true.
Yeah. So I believe it's more generalized responses. I don't think
For sure
it has the emotional connection, the deeper level of understanding of an individual's struggles. Like every individual has different kinds of struggles. There is no way that it knows what kind of a struggle is going through just because of some prompt.
Exactly.
Right.
So that clarity has to be there, and I'm not saying don't choose it, but be very mindful at what you use it for and what you don't use it for.
So it depends on how we use it.
Exactly.
Just maybe we could just use it for research purposes, but not something like a therapist.
Exactly. Yeah. The most alarming, the most dangerous thing about artificial intelligence is it delays the time when a person actually seeks help.
Yes. Right.
So that becomes the most impactful thing.
Yeah.
When any person is going through any mental health struggles, the quicker we start him on treatment, be it therapy, be it medication, or be it anything else, the quicker it starts, the quicker the recovery is.
Yes.
The more we delay, the more longer it is going to take and harder it is going to be. And the problem with any of these bots is it delays the time when a person seeks professional help.
Okay, yeah, that makes sense. So this concludes the suicide prevention episode. So is there anything that you would like to add in the end?
I just want to reiterate the things which I had already mentioned.
Okay.
When you or anyone you know is going through any mental health struggles, start small, but have a conversation with another person. Just have a conversation with the person who you think might be going through something, and never treat this as a sign of weakness. But always make sure you are talking to them. If I could suggest one thing and one thing alone, it would always be journaling. Always journal about your thoughts, always journal about the things that are happening in your day. But maybe you could end it on one good thing that has happened to you on a day even. But by doing this thing every day, it could be very helpful and very impactful in a person's life. And never ignore the subtle changes in your mental health. The smallest of change can have a butterfly effect down the line even. So any change that you notice, if you feel like it is something that needs to be looked at, just go talk to a mental health professional. They can always help you in a better way. And any mental health professional, they are not going to judge you. It is a safe space for you to talk about. So don't delay going to a specialist because of any other reason. That would be the one thing which I want to tell everyone.
So yeah, thank you for your time.
Thank you so much, Krishna. Yeah.